Hello, this is Dr. Behnam. I'm a board-certified dermatologist, and welcome to our educational videos. This one is about Botox. How long does it last, and how quickly does it kick in? So Botox is used to relax the muscles on the face in order to smooth out wrinkles and frown lines. It's typically injected on the forehead, the frown line between the eyebrows, as well as the wrinkles around the eyes. When injected into muscle, basically it prevents them from acting, and it actually relaxes them. That's how it works. Botox takes about 2 weeks for it to have its full effect on the face. It typically lasts anywhere between 3 to 4 months. That's on the average. Some patients less, some patients more. There are studies that have been done by the Crothers that show that the more of the botulism toxin you have injected into an area, the longer the results last. And that makes sense. That means the more you put in, the longer it's going to last. So in the frown line area, if I were to put in 30 units as opposed to 15 units, it would make sense that when I put in 30 units, it's going to last longer than when I put 15 units. Also, some patients actually develop what's called antibody to the Botox, which means they develop resistance to it. So in some patients, they could start out Botox working 4 months, and then the more injections they get, the less it's going to last. That's why it's so important that in the US we now have other FDA-approved botulinum toxins like Dysport and Xeomin, that we could actually rotate the patient between one to the other. This will prevent basically those patients from developing antibodies to them. Now, talking about other forms of botulism toxin, Dysport is the competitor to Botox. It's been in the US for the last several years. And is injected in the same areas that Botox is. Typically, my patients tell me that it kicks in a little bit faster, so they see the full effect and the full result a few days earlier than they do with Botox. Also, about half of my patients tell me that it does last a little bit longer than Botox, sometimes a few weeks longer. This is not true in everybody, but it is certainly the case in some patients. So my recommendation is, if you've had Botox before, try Dysport. You might like it better. But again, I always have patients who've tried one and they switch to the other one. So it's perfectly okay to switch from one to another one. I just typically would not try to do both Botox and Dysport in the same patient on the same day. Again, this is Dr. Behnam. I'm a board-certified dermatologist, laser skin cancer specialist. I practice in a beautiful Santa Monica, California. Please visit our website to watch other Botox videos that we have put up on our site, santamonicaskin.com. Have a beautiful day.